Hospitals in COVID hotspots across the country are once again reaching capacity, with more than 120,000 new cases a day on average across the country. That's the highest rate since before vaccines were widely available in February. And no surprise, the areas having the most trouble are also the areas with the lowest vaccination rates. But if you think all the unvaccinated coming down with COVID are learning their lessons, think again, as this man proved when he recently spoke to CBS News.
Here I am, recovering, getting out of here finally tomorrow. Am I going to get a vaccine? No.
Why not?
Because there's too many issues with these vaccines.
Too many issues. Again, the shots are overwhelmingly safe and effective at preventing the kind of symptoms that man suffered, but you knew that. But widespread conspiracy theories, many driven by leaders of the far right, just keep fueling the hesitancy.
You lucky people here in Alabama might get a knock on your door because I hear Alabama might be one of the most unvaccinated states in the nation.
Just today, Twitter suspended Marjorie Taylor Greene's account yet again, this time for a week, after she tweeted the FDA should not approve COVID vaccines, which she claimed are failing. And a new survey finds that far from the only lie people believe is that. Researchers with the COVID States Project asked 20,000 people across the nation about whether they believe 4 debunked claims about COVID vaccines, that the shots alter DNA, implant trackable microchips, cause infertility, or contain tissue from aborted fetuses. And the results? 20% said they believed at least one of the claims, and more than half weren't certain about one or more. Bad news in and of itself, but even worse news when you consider the consequences. Here to describe them is one of the principal investigators behind this effort. David Lazer is professor of political science and computer sciences at Northeastern and co-director of the NULab for Text, Maps, and Networks. David Lazer, it's good to see you again. Thanks for being here.
Oh, thank you for having me.
So the numbers themselves are upsetting, but are they any worse in terms of misinformation buy-in than the public is on almost any high-profile, controversial topic?
It's not clear that they are. Let's say if we were talking about climate change, we might imagine that there would be similar numbers. The reason why it's consequential, though, is that we're depending so much on the decisions of individuals to get vaccinated or not. And so being misinformed and making the wrong decision is very consequential for the individual and for society.
Well, I mentioned consequences, being misinformed and making the wrong decision. You make a causal connection in your survey, do you not? Could you explain that?
Well, certainly we find a strong association between being misinformed and not being vaccinated. And for that matter, even being uncertain makes you less likely to be, or is associated with being less likely to be vaccinated. It's hard to say in terms of the causal link just how much of this is directly caused by beliefs versus people who feel uncomfortable with the shots for whatever reason, coming up with rationalizations for why they're not getting vaccinated.
So I assume it's safe to assume that if what you say there is true, at least in association, that if you are wedded to the facts about vaccines, you're obviously more likely to get vaccinated, correct?
That's right. People who correctly answered all 4 questions were vastly more likely to be vaccinated.
Who are these people, by the way? You know that, do you not? Who are the categories of people who buy into the misinformation for whatever reason they do?
So let's see. There are a number of demographics that really pop out. I think that we see, for example, white respondents are more likely. They're middle-aged respondents. Interestingly, we see repeatedly through our survey that younger women, especially younger mothers, are more likely to be vaccine resistant and also to believe the vaccine misinformation. And indeed, one of the things that we see really pop out among the 4 types of misinformation that we look at is the fertility, is the misinformation regarding fertility being associated with lower likelihood of being vaccinated.
Your consortium, I believe in earlier research, also identified the sources most likely to provide the misinformation. And, we know that Joe Biden a few weeks ago said Facebook is killing people. The next day, he drew back a little bit. But your research suggests Facebook is killing people. They're the primary source of the misinformation, which you may not want to say that, but the misinformation, if that leads to vaccine hesitancy, is obviously going to lead to more casualties.
Certainly, we find that people who rely more on Facebook as compared to other sources are more likely to be vaccine resistant and less likely to be vaccinated and more likely to believe these misbeliefs.
So can I draw the conclusion that understanding and believing the facts about the vaccine are at least one path to herd immunity? That is implicit, at least in your research, is it not?
Yes, I certainly, it would certainly be consistent with our findings that if more people believe that the vaccines were safe, that they would likely help potentially protect their lives, that would yield higher vaccination rates and lead to greater protection to the overall population.
So I know this may not be your area of expertise, but obviously then, if we disabuse them of their false beliefs, they'd be more likely to get vaccinated. The question is that doable? And in another context, we were discussing on the show a couple of weeks ago, a professor from the University of Pennsylvania, a psychologist, who's actually has a book coming out, Creating Conspiracy Beliefs, How Our Thoughts Are Shaped, says when you get people who are sort of dug in with their beliefs that happen to be wrong, the more you try to convince them of what is right, the deeper they dig in. Is there any evidence that that same unfortunate outcome would hold here?
I think we've done some experiments on this in terms of trying to persuade people to get vaccinated. And the answer is it's a little complicated. So, for example, who the messenger is and what the message is matters.
Who's the best messenger?
The best messengers are people's own doctors, actually. And, if I were made king for a day, I'd say everyone should have a free visit to their doctor to discuss getting vaccinated because it's that kind of trusted messenger. But like people, who do you trust with your healthcare? It's your doctor. But it's a lot of people who have less access to medicine or doctors that are also vaccine resistant or hesitant.
That holds true unless your doctor is Dr. Rand Paul, by the way. I just want to correct your research there for a second. Quickly, before you go, have you seen actual evidence of people, not those who are driven by Trumpism, for lack of a better expression, but people who just misunderstand the facts, who when fed, for lack of a better expression, the truth, the facts, do flip their positions?
It's really hard to come up with evidence for that because, you really have to think about how you persuade people what the truth is, right? For them, their truth is their reality, which is very different from what you and I might believe.
David Lazer, really important research. Thanks for sharing it with us, and thanks for talking to us.
Oh, my pleasure. Thank you, Jim.
Thank you.